If you're wondering what the best exercises are to do after breast cancer surgery, this video is for you. This is part 1 in a 3-part series where I'm going to cover rehab exercises after breast cancer surgery, and this video covers the first 3 weeks after surgery. This is actually the exact program that I did after my double mastectomy, and then I did it all again after my reconstruction surgery. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. Let's get started. What you'll need in terms of equipment, there's one exercise that uses a ball. I use a lacrosse ball in the video. You can also use a tennis ball or any other ball that you already have at home. And another exercise uses a small resistance weight. So anything under 5 pounds will do at this stage. And if you don't have that, you can simply fill up a water bottle with water and that will do. The goals for the first 3 weeks after surgery are increasing your range of motion over time. So by 6 weeks, you want to have near full range of motion, and you'll just be sort of working your way up to that week by week. Decreasing pain, reducing any stiffness or tightness, and that's usually felt sort of in the chest area, in the underarm area, even towards sort of the back of the shoulder into the mid-back. Sometimes even the neck is affected. And lastly, to reduce the effects of cording and lymphedema. A few things to keep in mind when you're going through these exercises. The exercises should be pain-free. You may feel some stretching in some of the muscles. That's okay if it's very mild. If you're feeling any sort of like tug at the incision sites or any pain there, it's a no-go. You want to reduce the range of motion and keep it into the pain-free zone. Depending on where you're at with your drain situation, this will limit your range of motion. So let's say my drains were in about 6 days. Some people have them in for 2 weeks. So your range of motion will be reduced when you have them in because it's super uncomfortable to move your arm with drains in. So just be patient for them to be removed, and then once they are, you can sort of push things a little bit more with your range of motion. I found that I could do slightly more after my reconstruction surgery compared to my mastectomy, so sometimes I did things a little bit earlier with that second surgery. How often do you need to do these exercises? So for the first 3 weeks, you're looking at 3 times a day, every single day, about 10 to 15 reps per exercise. Consistency with these exercises will be greatly rewarded in the short and long term in terms of pain, function, etc. There are 8 exercises as a part of this series. The first exercise is called hand pumps. You're going to raise your arm up in front of you and make a fist, squeeze tight, hold for about 5 seconds, and then let it go, and keep doing that. At the beginning, you probably won't be raising your arms too high to do this, and your arm will probably be bent, but as you're working through this, you want to try to straighten your arm out a little bit more, and as you're feeling more comfortable, you can raise your arm higher. A variation on this exercise is squeezing the ball rather than just using your fist, but this is completely optional. The second exercise is neck circles, so you're going to start bringing your chin down to your chest, rotate ear to your shoulder, around to the back, ear to your other shoulder, and then down in the front. And once you make your way to the front, you're going to reverse directions and go the opposite way. So ear to the shoulder, back around, ear to the other shoulder, and around to the front. Why are we doing a neck exercise when nothing happened to that area during surgery? Because the neck is very closely tied to the shoulder. So better neck mobility results in better shoulder function. So it's really important to make sure that that area stays mobile. You can also get quite a bit of guarding in the neck after surgery as everything sort of tightens up in the chest and mid-back area, even into the shoulders, and that can make its way up to your neck, which can be pretty uncomfortable. The third exercise is shoulder circles. So this is very similar to the neck circles. You're going to start by bringing your shoulders up to your ears, pulling them back so you're squeezing between the shoulder blades, lower your shoulder blades down, and then bring them to the front. Make sure you go in both directions for this one. You want to try to keep your body pretty static as you're doing this exercise. So again, all of the focus can be done for the muscles surrounding the shoulder blades and not other parts of your body compensating. Activating all muscles around the shoulder blades is helpful to reduce some of the guarding that can happen after breast cancer surgery. The fourth exercise is actually a series of exercises for shoulder range of motion. So you're going to be lifting your arms to the front, to the side, and to the back. Raising your arms to the front, you're going to just simply lift it up to the front. You're going to try to keep straight arms as you're doing this exercise and go up as high as you feel comfortable. Some surgeons will have some sort of limit on how high you can raise, especially in the first couple of weeks after surgery. So check with your healthcare team to see if you're fine going beyond 90 degrees. Again, you shouldn't feel any real pain doing these exercises. A slight pull in the muscle is fine, but no incision type of pain as you're doing these ones. There's a tendency when you're doing the shoulder raised to the front for the shoulders to really hike up towards your ears. So you want to really try to keep your shoulders down as much as possible as you're doing this exercise. The next one is raising your arms out to the side. So you're going to start facing forwards and your palms are going to also be facing forwards, and you're going to raise your arms up to the side as high as you can comfortably go. Same rule applies with how high you can go. Check with your healthcare team on that. There's a tendency with this one also for the shoulders to sort of creep up as you're doing this exercise, so really try to keep those shoulders down. There's also a tendency for the hands to almost move forward, so they're not actually at your side. When the arms are right at your side going up, you tend to feel more of a pull in the pecs, so bringing the arms forward is your body's way of trying not to do that. So just try to keep everything in line. The last movement for shoulder motion is extending out to the back. So you're gonna have your palms facing to the back, and again, lift as high as you can go. There really aren't any limits with this one, so just go as high as you can comfortably move into that position. You wanna try to keep your arms straight throughout this exercise. The fifth exercise is shoulder internal and external rotation. Usually internal rotation isn't limited too much after breast cancer surgery, but external rotation is more. You're going to have your arm at your side at 90 degrees, and you're going to rotate it in so your palm goes towards your body, and then you're going to rotate out as far as you can go. You want to try to keep your elbow in at your side the whole time, so don't let it sort of creep out to the side. You can also do this exercise both hands at the same time, so if you've had a double mastectomy, you might as well do this all together. The sixth exercise is a shoulder blade squeeze. So you're going to start with your arms in front of your body, and then you're going to lead with your elbows and think about squeezing between your shoulder blades as you draw your arms back. Then you're going to just return to your starting position and continue that for the number of repetitions. You may actually feel a stretch in your chest area as you're doing this exercise. So again, just go to whatever your comfort level is with this one. This was one of my favorite exercises during this stage because I found that I had some mid-back tension, so it really helped to just pull my shoulders back and squeeze those muscles. Often really tight muscles do better not by resting them, but by actually activating and moving them. We have 2 more exercises to go, but if you're finding value in this video so far, hit that like button below, and if you're new here, consider subscribing. The 7th exercise is arm lifts. So you're going to interlace your hands in front of your body and slowly raise your arms up until you feel just a slight stretch but no pain. You can hold 5 or 10 seconds at the top before lowering down, and then continue doing the repetitions back and forth for this exercise. This was another one of my favorite exercises during this stage. I found that after lymph nodes being removed, there was a lot of tension in the underarm area, so this exercise really helped to open that area up. You can check with your healthcare team on the limits of how far you're able to lift up with this exercise. The 8th exercise is the pendulum. You can use small weights for this one or a filled water bottle, Or for the first few days after surgery, you can use nothing at all. So you're gonna have one arm that's gonna be supporting your body, and then the affected arm, you're gonna just hang there. You wanna feel like you're not sort of holding tension as you're doing this exercise. So you're gonna do circles in one direction 10 to 15 times, and then once you're done those, you're gonna go in the opposite direction for the same number of repetitions. One thing to keep in mind is your back position doing this. So you really wanna be fairly neutral in the back and not in that rounded position. Here's a summary of the 8 exercises for this stage of rehab. You could take a screenshot of this so you can easily reference this list as you're doing the exercises. If you're past the 3-week mark after your breast cancer surgery, this next video will cover the exercises to do for weeks 3 to 6 after surgery. See you there.